Hi, my name is Brielle Smith. I'm a second-year medical student at MUSC and a leader of the Community Vulnerability Project. Today's topic is how and where to get tested for COVID-19. I'm joined by Dr. Danielle Scheurer, a professor of medicine, attending hospitalist, and the Chief Quality Officer for MUSC Health. Dr. Scheurer, thank you so much for being here today.
Oh, my pleasure. Thanks for having me.
My first question is, when would you suggest a patient pursue testing for COVID-like symptoms?
So typically we tell people to get tested if they have any symptoms of COVID. In the early days of COVID, we included fever, chills, cough, and shortness of breath. But over the course of time, there are several other symptoms that we also do include in the screening tool. And we do recommend testing for these additional symptoms. Those include any sudden loss of taste or smell, myalgias or muscle aches, nausea, diarrhea, abdominal pain, sore throat, or headache. So it is a long list of symptoms, but any or all of those could be indicative of COVID, and we do recommend diagnostic testing for people experiencing any of those symptoms.
In South Carolina, how can one contact a physician about getting tested for COVID-19?
The easiest way is to go through the virtual urgent care platform, which is available to anyone in the state. So you just go to musc.care, C-A-R-E, which is our virtual urgent care platform. It's very easy to use from any device. It'll ask you a couple of questions, and if you have any symptoms of COVID, it will recommend testing. It will then allow you to go to a testing site near you.
And is there a cost associated with getting screened through the telehealth service?
There is not. So we did open that up in the early days of COVID, and that remains. Any citizen of the state of South Carolina, our virtual urgent care platform is free.
What locations are available for patients to be tested for COVID-19?
In the Charleston area, the primary location is at the West Ashley Citadel Mall parking lot. That is a very active location. Others within MUSC Health, there's a location in Florence, Marion, and Lancaster. And then in addition to that, there are several other locations, both fixed and mobile. And all of those are listed on the DHEC website, DHEC, or Department of Health and Environmental Control, which keeps us updated. There are literally dozens of sites in both major metropolitan areas and rural sites. And that active list is maintained by DHEC.
And my final question is, why should patients not come unannounced to an urgent care clinic to try to get a test for COVID-19?
That's a great question. We do use a very specific technique to collect a sample. It's called a nasopharyngeal swab. And the test itself can actually be risky to the test collector as well as people in the vicinity of the patient getting the test done. And so we try desperately to do all these tests in a controlled environment. So we try to avoid indoor settings unless it's a room with what we call negative pressure. So we try not to test in areas like urgent cares or emergency departments to limit the potential spread during collection. And that's why we have all these collection sites, most of which are outdoors and actually do the collection within a car, again, to limit spread. So we definitely do not recommend going to a clinic or an office or urgent care or emergency department. We would much rather have symptomatic patients go through a test collection site that are uniquely positioned to safely and effectively get a sample.
Dr. Scheurer, thank you so much for this important information.
My pleasure. Thanks for having me.
And thank you for joining us for this segment of MUSC COVID-19 Community Outreach and Resource Awareness.